Your erections are weaker than they used to be. You wake up without morning wood. Intimacy feels like a struggle instead of a pleasure. And you're wondering if this is just how life is going to be from now on. Let me stop you right there. What if I told you there's a specific spot on your body that when massaged for just 60 seconds a day can restore blood flow, reawaken nerve sensitivity, and bring back the kind of firm, reliable erections you thought were gone forever? This isn't about pills. This isn't about devices. This is about understanding your own anatomy and using a simple technique that works with your body's natural systems. Before we go any further, let me be clear about something. I won't be leaving any contact information in this video. No links to consultations, no paid programs, nothing. This channel exists solely to provide free, accessible medical knowledge to men who deserve real answers without barriers. Your privacy matters, and so does your right to information that can genuinely help you. Now, let's talk about what's really happening inside your body and why this one spot holds so much power. When you reach your 50s, 60s, or beyond, your body goes through specific changes that directly impact sexual function. These aren't random. They follow a pattern, and once you understand that pattern, you can interrupt it. First, your pelvic floor muscles become simultaneously tight and weak. Think about that for a moment. It sounds contradictory, but it's exactly what happens. These muscles, which control both urination and erections, develop chronic tension while losing their functional strength. Imagine a rubber band that's been stretched and left in the sun. It feels taut, but it's lost its snap. The tension restricts blood flow, and the weakness means these muscles can no longer support the hydraulic pressure needed for a strong erection. Second, your blood vessels stiffen. Arteries that were once flexible and responsive become less elastic. Plaque deposits accumulate on vessel walls. The result is that blood doesn't surge into your penis the way it once did. An erection is fundamentally a vascular event. Blood rushes in, fills the spongy tissue under pressure, and creates firmness. When vessels can't dilate properly, that whole process breaks down. You might achieve partial firmness, or it might fade halfway through, or it might not happen at all. Third, the nerves in your pelvic region become compressed. Years of sitting, poor posture, stress, and even inflammation create pressure on the very nerve pathways that transmit arousal signals. When these nerves are compressed, sensation dulls, response time slows, the connection between your brain and your genitals weakens. It's like trying to have a conversation through a bad phone line. The message gets garbled. Now here's what most men don't realize. All three of these problems converge in one specific location on your body. This spot sits at the intersection of major blood vessels, critical nerves, and the root structures of your penis. It's called the perineum, and it's located between your scrotum and your anus. In traditional medicine, this area has been recognized for centuries as a point of profound influence over male vitality. Modern anatomy confirms why. Beneath this small patch of skin run the pudendal arteries, which supply blood directly to your penis. The pudendal nerve, which carries sensation and arousal signals, passes through here as well. The bulb of your penis, the internal root that you can't see, anchors in this region. And just above it sits your prostate gland. When you apply targeted massage to the perineum, you're directly influencing all of these structures at once. You're encouraging blood vessels to dilate. You're decompressing nerves. You're releasing muscular tension. You're stimulating circulation to the prostate. It's like hitting a reset button for your entire pelvic region. Men who discover this technique often describe it as if a traffic jam suddenly cleared and everything started flowing again. That's not poetic language. That's an accurate description of what's happening physiologically. So how do you actually perform this massage? Let's break it down step by step because technique matters. First, you need to locate the spot. Sit or lie in a comfortable position where you can reach between your legs without straining. You're looking for the area directly between your scrotum and your anus, right in the middle. When you press gently with your fingertips, you should feel a slight indentation. The tissue might feel tender. That tenderness is actually confirmation that you've found the right spot. It indicates areas where tension and congestion have built up. Once you've located the perineum, the massage itself is straightforward. Use your index and middle finger together. Apply steady, moderate pressure. Not light, not aggressive, but firm enough that you feel the tissue yield slightly under your touch. Think about the pressure you'd use to test the ripeness of fruit. Enough to feel its structure, but not enough to bruise it. From there, begin making small circular motions. Move clockwise for 30 seconds, then counterclockwise for 30 seconds. That's it. 1 full minute. Some men prefer a gentle up and down motion instead, almost like rhythmically bouncing on the spot. Others find benefit in pressing firmly for 5 seconds, releasing for 5 seconds, and repeating. All of these techniques work because they accomplish the same goal. They pump stagnant blood out of congested tissues and draw fresh, oxygenated blood back in. They stimulate nerve endings that have grown sluggish. They release muscular knots that have been restricting flow. Now, while you can perform this massage with dry fingers, using the right oil makes an enormous difference. Oil isn't just about comfort or reducing friction. It carries therapeutic properties that enhance the entire process. Castor oil is my top recommendation. This oil has been used in traditional medicine for thousands of years because of its unique ability to penetrate deep into tissues. It's composed almost entirely of ricinoleic acid, a fatty acid that simultaneously reduces inflammation and stimulates circulation. When you massage castor oil into the perineum, it doesn't just sit on the surface. It travels into underlying structures, reaching muscles, nerves, and blood vessels. Many men report a gentle warming sensation during or after application. That warmth is increased blood flow. Coconut oil is another excellent choice, particularly for men with sensitive skin. Virgin coconut oil is naturally antibacterial and anti-inflammatory. It absorbs cleanly without leaving a greasy residue, and it has a pleasant scent. Coconut oil also contains medium-chain fatty acids that support hormone balance and reduce systemic inflammation, both of which contribute to better erectile function. For men who want something more potent, black seed oil offers powerful benefits. This oil contains thymoquinone, a compound that research has linked to improved vascular health and testosterone support. It's been used in traditional Middle Eastern medicine for centuries as a male vitality tonic. The only downside is that it's less commonly available and typically more expensive. But many men find the results worth the investment. You can also enhance these carrier oils by adding a few drops of essential oils. Peppermint oil stimulates circulation and creates a refreshing, tingling sensation. Rosemary oil awakens nerve function and has been traditionally associated with memory and vitality. Sandalwood oil has a long history of use in supporting male reproductive health. Just remember, essential oils are highly concentrated. 3 to 4 drops per ounce of carrier oil is plenty. More than that risks irritation. Using oil transforms this practice from a simple mechanical massage into a genuine therapeutic ritual. You're not just pressing on tissue. You're delivering compounds that calm inflammation, open blood vessels, and nourish cells. The combination of physical stimulation and biochemical support creates results that are greater than either approach alone. Now, let's talk about what actually happens inside your body when you perform this massage consistently. Understanding the mechanisms makes the practice feel less abstract and more empowering. The first effect is direct mechanical stimulation of blood flow. When you apply rhythmic pressure to the perineum, you're acting like an external pump. You're pushing venous blood, which is deoxygenated and stagnant, out of the tissues. This creates space for fresh arterial blood to rush in. Over time, this repeated flushing action improves the overall health and responsiveness of local blood vessels. They become more flexible, more reactive, and better able to dilate on demand. The second effect is nerve decompression. The pudendal nerve, which is responsible for genital sensation and erectile function, can become trapped or compressed by tight pelvic floor muscles or facial adhesions. Gentle massage releases these restrictions. It's similar to how massaging a tight shoulder can relieve a pinched nerve in your neck. Once the nerve is free to transmit signals clearly, sensation returns. Arousal becomes easier. Response time improves. The third effect involves the prostate gland. This walnut-sized gland sits just above the perineum, and it plays a crucial role in sexual function and urinary health. As men age, the prostate often becomes congested. Blood flow slows, inflammation increases, and the gland can enlarge. By massaging the perineum, you're indirectly stimulating circulation to the prostate. This helps reduce congestion, supports hormonal activity within the gland, and can even improve urinary symptoms. Many men find that not only do their erections strengthen, but they also experience fewer nighttime bathroom trips and better urinary flow. The fourth effect is pelvic floor relaxation. These muscles are often chronically tense in men over 50. Stress, poor posture, years of sitting, and even subconscious guarding from past pain or discomfort create persistent muscular knots. These knots restrict blood flow and impair the muscular contractions that contribute to erection rigidity and ejaculatory force. By applying massage to the trigger points in the perineum, you release this tension. The muscles soften, lengthen, and regain their functional strength. This doesn't just improve erections. It enhances bladder control, reduces lower back pain, and improves overall pelvic stability. The fifth effect is nervous system regulation. This massage activates the parasympathetic nervous system, which governs rest, digestion, and sexual arousal. Modern life keeps most men stuck in sympathetic dominance, the fight or flight state. Chronic stress elevates cortisol, which directly suppresses testosterone and constricts blood vessels. By spending just 1 minute each day stimulating the perineum, you're sending a powerful signal to your nervous system that it's safe to relax. Cortisol drops, testosterone stabilizes, blood vessels dilate. The entire hormonal and vascular environment becomes more favorable for sexual function. All of these mechanisms work together synergistically. You're not just improving one aspect of erectile function. You're addressing circulation, nerve health, muscular tension, prostate congestion, and hormonal balance all at once. That's why such a simple practice can produce such profound results. So, when should you perform this massage, and how often? Consistency matters far more than intensity. A single minute done daily will produce better results than occasional longer sessions. Morning is an excellent time because your testosterone levels peak shortly after waking. By massaging the perineum early in the day, you're amplifying your body's natural hormonal surge. Many men who choose morning practice report feeling more energized throughout the day and noticing firmer spontaneous erections. Evening practice has its own advantages. Performing the massage before bed shifts your nervous system into a relaxed state. It lowers stress hormones, promotes deeper sleep, and often improves the quality of nighttime and morning erections. Some men find that their sleep becomes more restorative and their mood more stable when they end each day with this brief ritual. If you're planning intimacy, performing the massage 2 to 3 hours beforehand works well. It primes your system without overstimulating it. You'll feel ready rather than distracted. In the beginning, start with every other day. This allows your body to adapt without irritation or soreness. After a week, most men can comfortably shift to daily practice. For those who want maximum benefit, twice daily, once in the morning and once at night, can accelerate results. But let me emphasize this. More is not always better. Pressing too hard or massaging too long can leave you sore, which discourages consistency. The goal is gentle, regular stimulation, not aggressive, deep tissue work. Think of it like watering a plant. A little bit every day is far more effective than drowning it once a week. Let's talk about common mistakes, because avoiding these will keep you on track. The first mistake is applying too much pressure. Many men assume that harder is better. It's not. Excessive force can bruise delicate tissues, inflame nerves, and leave you uncomfortable for days. This isn't a muscle you're trying to fatigue. It's sensitive anatomy that responds best to gentle encouragement. If you feel significant pain during the massage, you're pressing too hard. The second mistake is skipping the oil. Some men want to keep things minimal and press with dry fingers. This not only feels less comfortable, but it also sacrifices half the therapeutic benefit. Oil nourishes the skin, enhances absorption, and often carries its own healing compounds. Using oil turns a basic technique into a complete treatment. The third mistake is poor positioning. If you're straining your back, twisting your arm awkwardly, or cramping your hand just to reach the spot, you won't stick with this practice. Comfort matters. Experiment with different positions. Lying on your back with knees bent works well for many men. Sitting on the edge of a chair with one foot elevated is another option. Standing with one leg propped on a stool gives easy access. Find what feels natural for your body. The fourth mistake is inconsistency. Some men try this for 3 days, don't see dramatic results, and quit. That's like planting a seed and expecting a tree by the weekend. This technique works cumulatively. Each session builds on the last. Circulation improves incrementally. Tension releases gradually. Nerves wake up over time. You need to give your body at least 2 to 3 weeks of consistent practice before expecting noticeable changes. The fifth mistake is neglecting overall health. This massage is powerful, but it's not magic. If you're smoking, drinking heavily, eating processed foods exclusively, never exercising, and sleeping poorly, 1 minute of perineal massage isn't going to reverse all of that damage. Think of this technique as one essential component of a broader commitment to your health. It works best when combined with hydration, nutritious food, regular movement, stress management, and adequate sleep. Now, let's address realistic expectations, because understanding what this practice can and cannot do is crucial. Within the first few days, many men notice subtle changes. Greater warmth in the pelvic region during or after the massage, a sense of relaxation, improved sleep quality. Some men experience firmer morning erections almost immediately. These early signs indicate that circulation is improving and your nervous system is responding. By the second week, the benefits typically become more apparent. Energy feels steadier. Morning erections may return or become more reliable. Some men report reduced aches in the lower back or hips as pelvic floor tension releases. Urinary flow often improves, and nighttime bathroom trips may decrease. These changes reflect the broader impact of improved pelvic circulation and muscular function. Moving into the first month, your body has had time to adapt. Testosterone levels often stabilize through natural hormonal balance rather than artificial stimulation. Circulation in the pelvic region continues to improve. Erections typically become stronger, easier to achieve, and more sustainable. Confidence naturally follows. Many men also notice better mental clarity and mood stability as chronic stress hormones decline. Over the long term, 3 months and beyond, the results can be transformative. When this massage is practiced consistently alongside healthy lifestyle habits, the improvements compound. Erections become reliably firm. Stamina returns. Overall vitality increases. Some men report regaining sexual function they thought was permanently lost. But here's the key. Results vary based on your starting point. A man with mild circulatory issues and overall good health may see dramatic improvement within weeks. A man with significant arterial disease, diabetes, or heavy medication use may take longer and see more modest gains. That doesn't mean it won't work. It just means patience is essential. This practice cannot reverse severe arterial blockage that requires medical intervention. It cannot cure underlying hormonal disorders that need pharmaceutical treatment. It cannot replace necessary lifestyle changes. But what it can do is support, enhance, and often restore function within the limits of your individual physiology. For many men, that's more than enough to dramatically improve quality of life. Beyond erectile function, this massage offers unexpected benefits that often surprise men. Improved bladder control is one of the most common. That frustrating dribbling after urination, the constant nighttime trips to the bathroom, these often diminish significantly. Why? Because a relaxed, functional pelvic floor supports bladder function just as much as it supports erectile function. Many men find that after a few weeks of consistent practice, they're sleeping through the night without interruption. Chronic lower back and hip pain often improves as well. The pelvic floor muscles connect to your hips, lower spine, and core. When these muscles are chronically tight, they pull on surrounding structures, creating pain that radiates outward. Releasing this tension through perineal massage eases strain throughout your entire lower body. Some men experience relief from discomfort they've carried for years, pain that physical therapy and medications never fully addressed. Athletic performance can improve too. The pelvic floor is part of your body's foundational structure. When it functions properly, your balance, stability, and power transfer improve. Men who exercise regularly often notice better form, greater endurance, and faster recovery once their pelvic floor tension releases. Mental and emotional benefits are also significant. Stress hormones drop, mood stabilizes. Many men report feeling more confident, not just sexually, but in all areas of life. There's something empowering about taking control of your own health, about performing a simple daily practice that produces tangible results. It shifts your mindset from passive acceptance of decline to active participation in your own vitality. The key to experiencing all of these benefits is turning this practice into a permanent habit. The challenge isn't learning the technique. It's sticking with it long enough for the benefits to accumulate. Here's how to make it effortless. First, tie the massage to an existing habit. If you shower every morning, do the massage immediately afterward. If you have a bedtime routine, add this as the final step. When you anchor a new behavior to something you already do automatically, it requires no willpower. Second, keep your oil visible. A small bottle on your nightstand or bathroom counter serves as a constant reminder. Out of sight truly is out of mind, but when you see it daily, skipping becomes harder than just doing it. Third, track your progress. Keep a simple journal. Note how you feel each day. Rate your energy, your mood, your physical response. Over weeks, patterns emerge. You'll see evidence of improvement that might otherwise go unnoticed. This documentation becomes motivation. It proves that your effort is paying off. Fourth, release perfectionism. You don't need to perform this at the exact same time every single day. Life happens. If you miss a day, don't compensate by doubling up the next time. Just continue normally. Consistency over time matters far more than rigid adherence to a schedule. Even practicing 4 to 5 days per week produces meaningful results. Fifth, view this as preventive maintenance, not just problem solving. Even if your sexual function is currently satisfactory, this practice helps preserve it as you age. It's always easier to maintain health than to restore it once it's gone. Think of it like brushing your teeth. You don't wait until you have cavities to start. You do it daily to prevent problems. So here's where we are. You now understand why erectile function declines with age. You know the specific anatomical spot that influences blood flow, nerve health, and pelvic function. You've learned the exact technique for massaging the perineum effectively. You understand which oils enhance the practice and why they work. You know the science behind the results. You're aware of the optimal timing and frequency. You know the mistakes to avoid. and you understand the broader benefits beyond just stronger erections. The only thing left is the decision. Will you take action, or will you file this information away and hope things improve on their own? 1 minute a day. That's the investment. 60 seconds of focused attention on a part of your body you've probably ignored for decades. In exchange, you get improved circulation, restored nerve function, reduced pelvic tension, better prostate health, and balanced hormones. You get firmer erections, greater confidence, and renewed vitality. This isn't about chasing youth. It's about refusing to accept unnecessary decline. Your body is designed to function well throughout your life. Sometimes it just needs support, guidance, and consistent care. This simple practice provides all three. The tools are in your hands. The knowledge is now in your mind. All that remains is commitment. If you found this information valuable, subscribe to this channel. We provide free, evidence-based health information that empowers you to take control of your well-being. Leave a comment below. Share your experience. Ask questions. Tell us what topics you want covered next. We read every comment and respond when we can. Your engagement helps us create content that truly serves you. Thank you for watching, and I wish you health, strength, and a truly good life.